It gives me great pleasure to announce this year's Peter Graham Cohuna Award, which is awarded jointly by ACRRRM and RDAA and recognises rural doctors who provide outstanding advocacy and medical service to their community. It is presented annually in memory of the late Dr. Peter Graham, who served the Cohuna community for 48 years. This year's winner, Dr. Jeff Robinson, has worked as a rural GP in Mount Beauty, Victoria, for more than 20 years. Jeff is a fellow of ACRRRM and a member of RDAA Victoria. He's highly regarded for his emergency care skills and his commitment to providing professional development in emergency care to doctors and practice staff in the region. It speaks volumes of Jeff's commitment to the profession of rural medicine and his community that this is the second national award he has received, the first being the RDAA Rural Doctor of the Year Award in 2015.
This award recognises doctors who go above and beyond to provide high quality healthcare by advocating for the healthcare needs of their patients, supporting their medical professional colleagues, and dedicating time outside their profession to be active community members. As an experienced rural generalist, Dr. Robinson is heavily involved in providing education and training to local doctors and healthcare teams, and he sits on a number of boards that focus on emergency care, training and education, including the Albury-based Hospital Emergency Department, the Emergency Care Clinical Network and Safer Care Victoria, as well as more. On top of this, Dr. Robinson is an active volunteer firefighter, lieutenant and training officer with the Gundowring Rural Fire Brigade. During recent fires that ravaged the region, Dr. Robinson was at the fire front line, battling the flames alongside fellow firefighters during the night, before gathering a few hours rest in the morning and working in the Mount Beauty Medical Centre in the afternoon. It's legendary, and that's why we're so proud to present you with this award.
So it's been a really difficult year for everyone, obviously, but for us in the Northeast, particularly, it started out back in November of last year with fires on our doorstep, and then the whole Northeast ended up alight, and so we had 3 months of really busy firefighting. Our hospitals were evacuated and the whole town ended up empty and just leaving us defending the town, basically. And right through that, it was very busy and hard, and we were looking forward to a break when the spring came, and there was this rumour of a virus overseas, and that rumour grew into a global pandemic, and we really haven't had a break. So it's been a really hard time for everyone, and I know this award goes to only one person, but I'm so lucky to be supported by a really capable and supporting team of people. And I think for every rural doctor, there's a whole network of people keeping that person going in and working effectively. And I've got a wonderful support group of doctors around me, and the nurses I work with in our local health service are just inspirational, and the health service itself. The administration people have just gone above and beyond this year to keep our local population safe. And I'm just so proud of the way everyone has stepped up and put in extra hours right through the whole year, effectively without a break, right through the fires and then into the pandemic. And on a personal level, I'm really lucky to be supported at home. My wife, Libby, is herself a rural generalist. She is herself a firefighter. She spent 20 hours on the front line at Corryong on New Year's Day and drove through burning trees to get there. So she herself is an amazing inspiration for me, and I'm sure she works a lot harder than I do. And our wonderful daughters as well, who are every day an inspiration to me. So I just consider myself so lucky and privileged to be working in a job that I love and in a place that I love. And if it's hard work, I'm doing that because I'm so well supported, and I'm just so lucky to be here. So thank you.